Here today, it is estimated that around 4 million Australians aged 16 to 85 are affected by mental ill health. This represents about 20%, or 1 in 5 Australians. That is 1 in 5 people in each town or city, each workplace or each community. Of course, this covers a range of illnesses, from mothers struggling with postnatal depression, young people in schools, employees facing stress and anxiety in the workplace, to some of our ethnic minority communities who face a higher incidence of some conditions. The mental health of our LGBTIQ community is also of concern, with lesbian, gay and bisexual Australians twice as likely to have a high to very high level of psychological distress as their heterosexual peers. Aboriginal and Torres Strait Islander young people in the 15 to 17 years age group have a suicide rate more than 5 times higher than their non-Indigenous peers. These are our people and we must do more. In 2016, the ABS revealed that suicide was the leading cause of death among all people aged 15 to 44 and the third leading cause of death among those 45 to 54 years of age. 2,866 Australians died from suicide in 2016, 11.8 people in every 100,000, around 8 people every single day, 1 person every 3 hours. There are around 65,000 suicide attempts each year in Australia. That's almost 180 people a day who want to end their life. These statistics are heartbreaking and confronting. Along Tasmania's northwest, in my electorate of Braddon, we have some of the highest rates of suicide in the country. We know that there is a prevalence of mental ill health for those living in regional, rural and remote areas. Tasmania's youth suicide rate is the highest in the country, which is why Shorten Labor government has committed to restore $4.5 million to TasReach funding, which is a specialist access program, which the Liberals cut in 2016, an additional Headspace centre in Burnie. But there is unspoken discrimination existing regarding mental health, like the vast inequalities in funding for research, like the lack of training in mental health of many health department staff, whether in GP surgeries, outpatient clinics, emergency departments or within our first responder units. Primary care professionals are telling us they need more training in mental health than they have. Like the lack of understanding of mental ill health that seems to characterise parts of the social security system, and like the willingness of this government to overpromise and underdeliver when it comes to caring and providing for those suffering from mental ill health. The WHO predicts that by 2030, depression will be the leading cause of disease around the world. People can lose years off their lives as mental ill health undermines their physical health too, increasing their vulnerability in the face of cancer, heart disease and other killers. Mental health must be at the top of our agenda for this government and future governments to come. When the new Prime Minister was asked on radio last week for his views on the fundamentalist Christian practice of gay conversion therapy, his response was, "It's just not an issue for me and I'm not planning to get engaged in this issue." Well, Prime Minister, allow me to be the first of many to tell you it is an issue for you. It's an issue for the nearly 5% of the Australian teenage homosexual population who live in fear of being subjected to a therapy that's been discredited by experts and can have dangerous and sometimes deadly consequences. Real leaders don't wash their hands of serious problems and say, "That's got nothing to do with me." They take a stand. They stand up for the mental health of our LGBTIQ population. They stand up and do more to tackle homophobia within religious organisations. They stand up and lead for the people, not fellow Christians. And they stand up and vote with a clear conscience, not abstain or vote with a religious conscience. Mental health is as much an economic challenge as it is social. The extra physical healthcare necessitated by mental ill health costs the health system several extra $1 million a year. The criminal justice system also picks up the bill, and more than 1 in 4 of our prison inmates report being on medication for a mental health disorder. But it's not just our public services that bear the brunt of mental ill health. Australian businesses do too, in time off work, in unproductive days at work. Mental health conditions across Australian workplaces, $4.7 billion in absenteeism and $145 million in compensation claims. This costs our economy too much more than we can afford. Labor knows there is much to do to ensure Australians living with mental ill health have access to the services they need, no matter where they live. Good mental health doesn't start in hospital or the treatment room. It starts in our workplaces, our schools and our communities, and it starts with this government.
Thank you, Minister Braddon.